America is full of confidence, joy, energy. America is full of life. Thanks in part to the work of USDA's Food and Nutrition Service to ensure all communities have access to healthy foods. For decades, USDA's programs have led the way in addressing food insecurity, helping people get enough food to eat. And while tackling food insecurity remains a top priority, we are expanding our focus to include nutrition security, connecting all Americans with foods that support good health and well-being. USDA is working hard every day to make our programs stronger than ever, helping schools serve our children food that is good for them and tastes great, strengthening and modernizing the WIC program so that more infants and children get a good start in life, and making sure all Americans know about tools like MyPlate that can help them eat healthy. By prioritizing both food and nutrition security today, the USDA Food Nutrition Service is helping ensure all Americans thrive.
All right. Well, thank you so much for putting that, on the screen for me and sharing. I'm afraid that if I would have tried to do that, it would have been all messed up. So, and I just wanted to take this time to tell you all that I really appreciate the work that you are all doing to address and improve mental health. Today, I just want to take a moment to introduce myself. My name is Aurora Buffington, and I am the branch chief for the new nutrition education branch, although we've been around for probably a little over a year now at the Food and Nutrition Service. And the nutrition education branch is under SNAP. So for the Supplemental Nutrition Assistance Program, their nutrition education component. So with that, I'd like to continue by talking a little bit about what you just saw in that video. And so to do that, we talked about USDA's focus on nutrition security. And I think it's really appropriate to talk about this because, as you heard, we are trying to enhance optimal health and well-being. And well-being includes mental health. We just heard about the connection to food security and how food insecurity can really decrease, people's sense of well-being and affect them. The ways that, may increase worry and anxiety and other things. So we know, too, that poor nutrition is a leading cause of illness in the United States. While food security focuses on ensuring that everyone has enough to eat, our nutrition security ensures that everyone receives and consumes the calories that contribute to their overall health. So, in essence, it's sort of like a difference in dietary quality. So beyond the effect on health, you all saw that poor nutrition and diet-related diseases have far-reaching impacts. And these far-reaching impacts include things such as lower productivity, decreased academic achievement, and increased financial stress, not to mention mental health stress, as you've heard. To make progress on these problems, Americans need equitable access to healthy foods that promote well-being. So one of the things I'm really happy to share is that public health providers are realizing that treating food security as a health issue can lead to better health outcomes for patients, including improvements in community health and cost savings. So these programs are leveraging and increasing the impact of the United States Department of Agriculture's Food and Nutrition Service. We have over 16 programs, and these programs are being used by public health now to address food insecurity and improve nutrition as well. Now, the USDA aims to support progress. Oops, got excited there. All right. So the USDA aims to support progress towards healthier eating patterns in an equitable way and launched its Food and Nutrition Security Initiative last year in March. The USDA Food and Nutrition Service is taking multiple actions in all of these 4 pillars that you see here, including weaving research throughout all of these pillars. And these are all shared, and the progress is shared in the report that's titled The Role of the USDA Food and Nutrition Service, that you see a screenshot of here, and can find easily by even just Googling nutrition security and USDA. Now, I'd like to focus on SNAP education. So SNAP is the acronym for Supplemental Nutrition Assistance Program, formerly known as food stamps. Now, many of you are, as I heard really proudly, related or connected to SNAP-Ed already through your land-grant universities and extension systems. But some of you may not be, and I'm not really sure if you know about SNAP-Ed, so I'll just give a little very high-level overview of SNAP-Ed. So while SNAP is the nation's most important anti-hunger program that helps low-income people in the United States afford a nutritionally adequate diet each month, SNAP Nutrition Education, or SNAP-Ed as we call it, is its nutrition education and health promotion component. Now, as part of a state's SNAP operations, state agencies have the option of providing SNAP nutrition education to SNAP participants and other low-income individuals that are eligible to receive SNAP benefits. I'm happy to say that all 50 states do provide SNAP education, including the District of Columbia and Guam. Now, this year, a total of $516 million is available to the states to fund SNAP-Ed initiatives. So in order to receive SNAP-Ed funding, states' SNAP agencies have to submit a plan annually to the Food and Nutrition Service. And this plan should include a needs assessment to help determine the priority audience segments that would be best served by SNAP education, along with the description of the selected intervention goals and objectives. And I really wanted to emphasize that needs assessment, because a needs assessment, as you guys have been sharing, can show that there is a great need to address mental health in adolescents in the Western region, or whatever turns up in those state SNAP needs assessments. And this is a really nice way to connect SNAP-Ed work to the needs of the state. Now, SNAP-Ed uses a combination of interventions to address nutrition security and health, because we know that many factors influence, right, food and physical activity behaviors. So you saw a socioecological model today, and I'm sharing a very simplistic one here, but that shows the different levels. And at these different levels, SNAP-Ed interventions are targeting organizations and individuals and groups to try to make a difference and to influence our diet and physical activity. Now, our program, or the SNAP-Ed program's approach, has evolved over the past 30 years. And it used to consist entirely of direct education classes, but now employs a comprehensive multi-level community and public health approach, as you see here, using more upstream approaches, such as social marketing and using policy systems and environmental change strategies. But I want to emphasize that partnerships are a key ingredient in SNAP-Ed's ability to support healthy communities. In 2022, the state SNAP-Ed programs worked with nearly 29,000 partners nationwide to help implement changes that favor healthy eating and being physically active. Many of those local partnerships are helping build programs that support healthy communities. I'm going to share just 2 right here. This is only 2 in many, many, many that exist out there. The first one that I'm highlighting here is the Live Well Faith Communities Intervention. It's helping create a healthier rural Alabama by forming faith-based partnerships where they provide nutrition education to rural participants and assist faith community leaders in identifying needs and implementing policy systems and environmental changes to make the healthy choice the easy choice. Again, needs assessments, and these are focused around the community's participation as well. Another example of a partnership that I wanted to highlight today provides innovative and holistic services between the White Earth Nations SNAP-Ed program and the Maternal Outreach and Mitigation Program, also known as MOMS. The MOMS outpatient program helps moms gain the skills that they need to follow a healthy diet after achieving sobriety. And SNAP-Ed is providing culturally grounded nutrition information to help them follow a healthy diet and learn how to cook healthy meals for themselves and their children. So these stories just show how nutrition education can improve the lives of program participants and make a difference to future generations. Really important key factors in healthy communities. So hopefully this very brief presentation, also you can consider it as an appetizer as well, and hopefully it was a healthy one, has enhanced your awareness of SNAP education, and hopefully it's emphasized the value placed upon our SNAP-Ed partnerships. It is with great excitement that we at the Nutrition Education Branch look forward to continuing to provide quality nutrition education with a meaningful public health approach that improves nutrition security and the health and well-being of low-income Americans. So thank you for giving me a moment to, to address you all, and I invite you to connect with us if you desire. You can connect with us through our SNAP-Ed Connection website. The address is right there, the URL. If you're interested in learning more about your state SNAP-Ed agency, we also have a webpage that's linked there with all the state SNAP-Ed program contact information. And of course, you can always subscribe to our SNAP-Ed Connection e-bulletin, and you can find that also on the SNAP-Ed Connection website. So with that, I'm going to yield the screen back to Annie or Dr. Lindsay.